With the overall cases being down 10%, you might wonder just how accurate are the numbers, and they're coming from many different directions. People are now able to test at home, with many positive results going unreported. So we decided to bring in an expert from UNC to help us fully understand the numbers and what they mean. Joining us now is Dr. David Wohl. Thank you so much for being with us. Dr. Wohl, how accurate are these case numbers, and should people still be looking at those given so many people are taking these at-home tests and not reporting the results?
Yeah, Gerald, it's a really important point that we're undercounting, but I do think trends matter. And when we start to see downward trends, especially in things like wastewater, ER visits, and also hospitalizations, those are real. So we may not have really good handle on what the case numbers look like, how many people are getting infected, but we do know how many people are getting infected and getting very sick. So I think that's the key thing to keep an eye on. That's what we've been talking about for a long time. And as you mentioned, those numbers look very stable.
To put this into perspective, how do the numbers today compare to the numbers we were seeing at the height of the pandemic?
Well, we have tough winters during this pandemic, and I'm really worried, of course, about what can happen during this next winter. But there's some things in our favor. As you mentioned, more and more people are getting vaccinated and, importantly, boosted, because the initial series protects you somewhat. Getting boosted tops you up, and you have better protection against infection and getting really sick. Also, lots of people are getting natural infection, including with BA.5. That's the dominant flavor of Omicron right now. I think if you get BA.5, your chance of getting it again is pretty limited, is pretty small. So as long as BA.5's around, I think a lot of people are immune to it through vaccines, through natural infection. And if it sticks around, that could mean our winter may not be as bad as it has been for the last couple of winters.
Let's talk about the wastewater sampling. We're seeing that the virus particles found in wastewater are continuing to rise. What leads to this, and how much stock should we place in this? How accurate is this for a measurement?
It's one metric we use. It's not the only metric, and I think people should understand this is wastewater. So COVID-19 doesn't only go into our noses and our mouths and our throats and lungs. It goes throughout our body, and we can find it in wastewater. So we can measure wastewater from different places and see how many virus particles are present. It's been a pretty good indicator of what's going to happen or how much burden there is out there with COVID-19. And as you said, it's been kind of trending up lately. So that just means there's a lot of virus out there, which if you talk to your friends, your neighbors, your coworkers, your family, there's a lot of virus out there. We don't really need the wastewater to tell us that, because if you just talk to folks left and right, there are people who are getting infected. So I think it's helpful. But if it starts going up and up and up, that's a bad sign. That means that there's a storm's coming, and we're just underappreciating it. But right now, it's pretty stable.
It won't be long before all kids are back in school. What are you concerned as far as that's concerned? What's your worry as far as that's concerned? And what advice are you giving people about avoiding getting sick?
Yeah, schools are a tough one because there's not a great appetite for masking in schools, even though we're under conditions that are very similar to the end of the last school year. And we did start masking again because case numbers were going up. So on the one hand, the consequences of getting infected are less as far as getting hospitalized, getting on life support. On the other, infections cost us. Infections cost us in long lines at the bank. Infections cost us to try to get an appointment at a doctor. We're short-staffed throughout all of our industries. And it doesn't help with the Great Resignation to also have 10, 15, 20% of your workforce out sick with COVID. So there's consequences of infection spreading. And unfortunately, kids spread the infection. So I think we're going to have to see what our appetite is for remaining unmasked in schools. I know it's a hot button issue, but the biology of this virus is such that if it keeps spreading and we see consequences of that spread that are unacceptable, we may have to take measures like more masking. So if you're really worried about it, my kid goes to school, he wears a mask. If your kid wants to go to school and wear a mask, that should be acceptable.
Yeah, to each his own. Dr. David Wohl, as always, we appreciate your time tonight. Thank you.
Anytime. Take care.